Hello everyone, this is Keith Hoover, founder and CEO of DashPoint Analytics. Today I'm going to show you one of our latest dashboards designed to keep track of COVID-19 in skilled nursing facilities. This dashboard pulls from your electronic medical record system, and it will assist you in tracking the tests you might be doing across your organization, as well as any signs and symptoms that may be triggered in your electronic medical record system related to COVID-19. So let me just go ahead and dive in. I've got this demo dashboard here, working off of some demo data, and we're going to go ahead and look at this top left visualization here. Now, the point of this visualization is really to track your tests over the course of time. You can see we have the last 14 days of tests. And of course, we could always filter by the care area. If you work in a continuing care retirement community, this can be helpful to separate out healthcare versus personal care or your independent living. You will see essentially four bars on this visualization. The dark blue bar is your total tests administered. Your light blue would be your total results that have come back negative. And your yellow would be your total positive tests, and your red, heaven forbid, if you actually have someone pass away from COVID-19, you would have that as well tracked here. This is a cumulative visualization. The one below it is a daily visualization, so you can sort of see what day you've, say here on the 26th, we gave 49 tests. And one thing you'll notice is as soon as I click that date or bar, data gets populated over in these other two areas. Essentially, these are separated by two different types. This would be by location. So if you're trying to track the number of tests and or positives or negatives within a particular area of your organization, you can do that up with this visualization. Or if you're more interested in the particular names of who, say, you tested on that day, you can see that. I can click on any other day. Right here is the deaths, and I can see who passed away. Looks like John Rogers would have passed away on 6/21. So you get a sense for how these visualizations interact with each other. So this is your overall organizational summary. This, of course, would be useful to your CEO, your NHA, your director of nursing. But this dashboard will go further. We have this area called the resident matrix. As you know, many states are requiring mandatory reporting of tests, signs, and symptoms, many saying it must be done daily. And the point of this matrix is to assist with that, submitting those daily results. It's going to give you your full residence census, as well as number of tests given, the last test to take that was administered, and the results of these tests. So you can see these, for instance, these first four were recently given tests. They don't have results yet. Then as we move right, you can see some of the key vitals, as well as the count of signs and symptoms that they may have triggered during their time with you. So this is very useful to keep track for those daily submissions to Department of Health. You can also go up to the three dots here and export the data directly to Excel. That's very helpful if you want to do your own analysis. The other area is this residents with signs and symptoms. Your infection control nurse might be particularly interested in this. This analyzes two areas. It actually will analyze your nurse's notes and look for any key signs and symptoms that may have been triggered. And it will use a sophisticated artificial intelligence actually to do natural language analysis to see if a particular sign and symptom is mentioned, and if it's indicating positive or negative of that particular sign and symptom. The other thing it will do is it actually can track if you have a particular user-defined assessment you have in your electronic medical record system. and it will track the results related to that, whether it be triggered by your aides at a touch screen, for example, or if it's some sort of RN or LPN assessment. The other area is the key vitals. It's going to give you a snapshot across your organization. You can filter obviously by care level, and it's going to give you anyone that's triggering some vitals that may be of concern. For instance, we have a couple residents that have low pulse ox, and so you can see when they got triggered and what the pulse ox was. And it's important to note on any of these screens, the resident matrix, signs and symptoms, or key vitals, you can right click on any resident and hit drill through and choose resident summary, and you can see a full resident summary of that particular resident. Obviously the top gives you your key demographics, and then it's going to give you any signs and symptoms they may have triggered while being with you. It gives you the full list of diagnoses, their most recent vitals, as well as their active physician orders. And any of this is also exportable if you wish. So that gives you a general idea of what this dashboard provides. I encourage you to visit our website at www.dashpointanalytics.com, or drop us an email at info@dashpointanalytics.com. And of course, you can always pick up the phone and call us at 717-400-5551, and we'd be happy to get this dashboard set up for your facility.